Hi, everybody. Welcome back to the Quench Life podcast. I am super excited to have Christina from Uplift Physical Therapy in Chatham back with us today, and we're going to be talking about working out in pain. It's a huge conversation, I feel like, and I'm super thankful to have her here to walk us through all of it.
I'm so happy to be here. Thanks for having me.
So I feel like let's just talk about pain in our bodies as women. Can we just kind of start off with we're getting
Yeah.
older, so I always say to everybody like most of us have some type of boo-boo or thing that hurts, and that's just because we're getting older.
Right. Yeah,
But why don't you walk us kind of through pain and what that feels like and sounds like to you?
sure. Yeah, pain is such a fascinating topic. I think we tend to have like a really linear idea of pain. Like there's injury to a tissue and we have pain because of that injury. And it's so much more complicated than that. And I could honestly talk about the science behind it for a very long time, and I won't bore everybody with that. But there are multiple different kinds of pain. There's what's called in like the scientific medical community nociceptive pain. What that means is that's pain that is generated at the level of the tissues. So it can be in a nerve, a muscle, a joint. Our nerves sense the pain, send the signal up to our brain, and we feel pain. That's kind of what most of us are familiar with the idea of pain. That's actually not the only way that we can have pain, though. We can also have what's called nociplastic pain, which is pain that occurs. Maybe it started as nociceptive, so initially there was an injury, the nerve started sending pain to our brain. But then what our brain does after it's been getting that signal for a long time over and over again, it's like, okay, these pathways in the brain keep getting triggered. It's just going to be more effective for us to keep these pathways turned on than it is to keep turning them on and off. It takes more energy to turn them on and off. It's a very simplistic explanation, but basically, our brain starts kind of communicating pain in our system without there actually being an injury happening anymore in the body. So that it's really common, for example, for someone to like maybe they bent over and lifted something heavy and they strained their back. That was initially what we call nociceptive pain, where the muscles were strained. They're sending signals to our brain. But now, every time for the next 3 years, every time they bend over, they get the same pain. It's very unlikely that those muscles didn't heal. Like the damage, our bodies know how to heal themselves. The damage heals, but our nervous system is stuck in the pattern of telling us that that is a dangerous or a painful activity. So pain is way more complicated than we oftentimes think that it is. But understanding that it's really complicated, I think, is really important and something that everybody should have at least some level of understanding of, because if you're constantly thinking that every pain you have is a sign of damage in your body, like that's pretty scary. That's a pretty disconcerting way to feel. So to understand that that's not always the case can be really helpful.
That's super interesting information. So what you're saying is that if I hurt my back on a Saturday in the yard, my body's going to naturally repair it. And then I could still get sensors that my back hurts. You know, that vibe of like, ooh, my back is twinging when I bend over again, but it doesn't necessarily mean that your back is still bothering you.
Exactly. And a lot of that is kind of it's an adaptation. Like if you bent over and hurt your back, your brain's going to be like, "Ooh, bending over is a bad activity. I'm going to send you pain so that you don't do it again." It's like your body trying to protect itself from getting injured again. But what it really ends up doing is having us avoiding doing things that we really don't need to be avoiding. So what starts as like it would be a really helpful adaptation if that only lasted for a week while your back was still healing. But unfortunately, our brain doesn't just shut it off, and so it can continue for a long period.
Yeah. So how do we work to moving towards either rewiring our brain or getting ourselves to understand the difference between, you know, this is just reminding me not to hurt myself versus being in super pain?
Yeah, it's a great question. It's honestly still something that like the great minds of the world are trying to figure out. But some of the things that can be really helpful are, first of all, trying not to panic. So if you every time you bend over, you get pain. If you see something on the floor and you're like, I'm going to have to pick that up, and I immediately start thinking, oh my God, it's going to hurt. This is terrible. It's much more likely to hurt because I'm reinforcing to my nervous system in my brain that it's doing the right thing. Like you are correctly telling me that this is dangerous. And so it's going to keep doing it. We also don't want to just like strong arm through it and say like, well, this is going to be excruciating and I'm going to do it anyway, because that's not great for our nervous system either. That's very stressful and it doesn't create like a nice, lovely healing environment for our bodies. So a happy medium is to say, what is a way that I can still do this task and have it hurt less? So there used to be a lot of focus on like, well, you just have to have perfect mechanics and it'll be fine. And I'm sure you see in the gym that there are people who can have perfect mechanics and they're still feel pain, because that's not going to solve it for everybody. So you might just have to do it differently. Like maybe I'll go onto one knee first and then bend over and get it. And that's less painful. So I do that over time and my body starts to learn like, oh, look, I can pick things up without pain. And then, that might start to feel better. And so maybe you come to a lunge position where like it's a little bit harder, but your legs are spread. It's maybe a little bit easier than just bending straight down. So you kind of gradually move yourself through progressively harder positions of doing the task where your body starts to learn like, look, I actually can do this successfully, and it starts to kind of rewire the way things are working.
Yeah. I think you said it, like pain is just such a crazy one that's hard to deal with and can also be super scary, because I think for most of us and a lot of us, it's like, I really don't want to get myself into this situation, again, that got me here. So I guess my first question is kind of differentiation, like minor pain versus big pain. Is that something that that exists, that you can kind of, and I'm sure it is, like throwing your back out versus breaking your
Right.
ankle, or two different things?
Right. Yeah, that's a really interesting question too. Like I'll have people come in the clinic a lot and I'll say, if you I actually kind of hate this question. Like if you had to rate your pain on a scale of 0 to 10, what would you give it? 0 being no pain, 10 being you would like go to the emergency room or the worst pain you've ever had. The reason I don't like it is because sometimes people get really fixated on what their number is, but it is a good baseline. And people will often say, well, my 8 is going to be different from someone else's 8. And it's like, yes, it is, but I'm only interested in what your 8 is. So generally, those higher pain levels, 8, 9, 10, are going to occur after a more significant injury, and the lower pain level might occur from a more minor injury, but that's not the case for everyone. So for example, if you're someone who's had chronic pain and your nervous system is so just like ready to give you pain, because that's what it does all the time, you might get a really high pain response to a lower injury load. So the amount of pain you're having isn't always correlated to the amount of injury. And so it's kind of hard to say, like, if you have, 7 out of 10 or greater, you're injured more than you would be if it's lower, because it's not always the case. But it's more about being familiar with your own baseline. How do you typically feel? Are you typically someone who has some pain at baseline or not? And how much worse is the current pain that you're having compared to how you usually feel? And that's very subjective, and it can be a hard thing to do, and sometimes it takes some guidance with like the PT or a personal trainer, like someone who you can actually talk back and forth with about it, because sometimes we get in our own heads about it and it can be a little bit tricky to figure out where we're at.
Yeah, I find that a lot, with people coming off of like knee surgery, knee injuries, where it's like, well, I need to learn how to get up and down off the floor. And, I feel like so much it's in our head, in the sense of like, well, you can probably do it. It's just your brain connecting and saying it'll get you up. Of course, we can make modifications and help and assist with that, but I feel like so much it's just in our brain that that's bad, and we can't do that.
Yeah, exactly. And like if it hurts for like a minute while you're doing the task and then it goes right away, that's very different from it hurts during the task and then you're in pain for the rest of the day. So sometimes it's not even about how much pain you're having in that moment, but how does your body respond to it for the rest of the day?
Yeah. So why don't we have generalize the conversation, and let's just talk about back pain. I feel like all of us have some version of back pain, whether that's where we carry our stress or it's something, that we injured in the past. So if you wake up in the morning and my back hurts or it feels tight, like that's just everyday aging. Can you kind of walk me through like some different basis, like what is the difference in pain that we could be feeling, and when is it okay, that's just you waking up and need to get the old civic going?
Right.
versus like, oh no, you should pay attention to that, your body's definitely giving you feedback.
Yeah, that's a great question. So, in general, if you're waking up in pain, that is some kind of feedback from your body. And then we're going to, get more and more feedback as we move through the morning. So generally, arthritis anywhere in our body is going to be the most sore the first thing in the morning because the joints have just been sitting in one position and should get better once we get up and start moving. So a lot of people are going to find that they do wake up with that back pain and then they get up and start walking around, doing some gentle stretching, and the pain gets better. And that is kind of a really typical pattern of arthritis that, not to say that that's not bothersome or blow that off, but that's not necessarily something that I would say, oh my gosh, like you need to do something about that right away. It is a cue that you probably need some strengthening of the back and the core and some general mobility work so that you keep it from getting worse. Like there are things you definitely want to take from that cue and learn, but not necessarily things that are going to say, okay, you need to like make some big changes. The times when we think, okay, like you might need a little more attention to that is if you get up and you start trying to move and do things and the pain doesn't get better or it starts to get worse, or you find that over time you're waking up in more and more pain, or you're waking up multiple times throughout the night because you have to reposition because of the pain. That's when your body's ability to adapt has been compromised. Like you can no longer adapt to the changes that have happened on your own and you need some more support. The first line of treatment for that type of pain is almost always physical therapy. And then there's a whole host of other components of care that can come into play from a medical standpoint, like medications and injections and things like that. As you know, because you work with people in movement all the time, we can often make some pretty big changes by just changing the way that we're moving. So that kind of like if you're waking up in a lot of pain and it's not going away, that doesn't necessarily mean that there's something major going on structurally. It could be more of a nervous system adaptation, like that we talked about at the beginning of our chat, where your nerves are just not able to come out of that pattern of signaling you that you're in pain. And even though that's not necessarily like a tissue damage issue, we can still really work on that in PT.
I feel like that's such a interesting, like our bodies are so cool.
Yes.
Like I know pain's not cool, but it's just so cool how our body, works through all this stuff. I always just find it so interesting.
Yeah. There's this really famous pain scientist. His name is Lorimer Moseley. He's from Australia. And he did a TED talk probably 10 years ago now, about this is when we were first starting to understand the difference between nociceptive and nociplastic pain. And he tells this true story from when he was younger, that he was walking through the Australian bush. He felt what felt like a twig scratch his leg, and he was like, whatever, that was no big deal. And then within a few minutes, he was keeled over in pain. It was actually a venomous snake bite,
Oh,
and he had to get like emergent treatment, and he almost lost his leg. So then flash forward to he's recovered. He's back out for a walk again, and he feels a little scratch on his leg. And he screams in pain because his body has learned that that's a dangerous stimulus. And he looks down and it was just a piece of grass. But his body is like, last time this happened, like you almost died. So we're going to trigger you that this is an emergency the next time that it happens. And to me, that always stands out in my brain of like, yeah, like there, that guy, he wasn't doing that intentionally. He's not crazy. It's not all in his head. It's his body doing what it's supposed to do to protect him, but it results in pain. And so that's a really nice example of how that type of pain can develop.
yeah. And I don't think that we're kind of educated on that, knowing that your body, that's just your body's natural reaction. So, talking about how you could start working through that or making that better so your body in essence starts to calm down and not fires off warning signs.
Yeah, exactly. So if that guy were my patient, I might take like light fabrics and like rub them on his leg and like verbally guide him through like you are safe, like that type of thing to help his nervous system rewire. And that's the same kind of thing that we do with people with back pain. Usually it's more movement based. Let's do these really small or broken down versions of what you ultimately want to do to start to reduce the threat with those movements.
Yeah. So why don't you talk us through as a physical therapist, because I'm sure you see so many different versions of people in pain. I feel like I have so many clients that come in and they're like, oh, well, I started physical therapy because my shoulder was bothering me. I was doing the exercises and the movements with Christina, and then I stopped, and now my shoulder pain is back, and I have no idea. And I was like, well, it's probably because you stopped doing what she told you to do.
We're
So,
all guilty of that.
yeah, I'm not going to point fingers. But what is a physical therapist? What is it that you guys are working on? What is the end goal as far as, working with a client?
Yeah. So for me, every PT has a little bit of a different approach. My approach is at first, I want to figure out, am I dealing with more of like a nociceptive tissue damage pain or a nociplastic nervous system pain, or is it both? Because you can have both happening at the same time. And then the treatments really vary based on which of those answers it is. So if it's more of like a tissue damage type pain, we want to figure out what tissue that is. So for example, in the low back, since we've been talking about that, we might have joint pain from arthritis. We might have muscle pain, all the muscles that attach along the spine. I've never really seen a tendonitis in the back. The tendons are so little there. We don't tend to get a lot of tendon pain there, but I suppose it could happen. Interestingly, like a herniated disc is typically not a cause of back pain. It more often will cause nerve pain out into the extremities. So even if people have like an MRI saying that they have a herniated disc, it's more likely than not to be that they're having muscle pain instead of disc pain. Anyway, there are a lot of different tissues that it could be, and we do different tests to figure out are any of those specific tissues sensitive or generating the pain. And then if so, we would give exercises that aim at healing the pains. When we're trying to heal a tissue, we usually do what we call high rep, low load exercise. So exercise that's not very challenging, but it's getting the muscle to contract and relax a lot in order to put a little bit of stress through the tissue and encourage it to heal. We might do eccentric exercises, which I know you know what those are, but for the listeners, that's where you're trying to exercise a muscle in a way that's lengthening it instead of shortening it in a contraction. That can really help heal tissues. And then once they're healed, then usually trying to strengthen them and kind of get them functioning normally again within the system. We're also looking at why were those tissues injured initially. So did your back get injured bending over because you don't have enough flexibility in your hamstrings to bend, so you're doing more bending from your back for as one possible example. So we might do some flexibility work in the hamstrings to prevent your back from getting overstrained again. And then if it's more of like a neuroplastic pain, kind of your nervous system is responding to the experiences of pain in the past to continue to generate pain now that is either not consistent with an injury or is maybe higher than what that typical injury might normally give you. We're probably doing some of the other stuff I already mentioned to try to help the tissues heal, but we're also trying to treat your nervous system, which can be pretty challenging. And I obviously love my profession because it's what I do, but I would say as a profession, it's something that we are definitely evolving on getting better at. And so depending on who you're seeing, you may or may not get a lot of interventions to work on the nervous system. It's something I've personally been trying to get a lot better at in the past couple of years. But we do things like graded exposure, meaning kind of what I mentioned earlier, like you're breaking down the movements into parts that you can do without pain. Sometimes there's like coaching or mantras involved in that, like I am bending forward and I am not in pain and I can do this. And there are things like I've been recently doing a lot of vagus nerve toning. That's like kind of a hot topic in fitness right now, but in PT we can do like massage and movement-based techniques around the vagus nerve, which is a main nerve of your sympathetic nervous system or your flight or fight response, trying to re-regulate what that nerve is doing. And then like I will do manual therapy often or hands-on work around the nerves themselves to try to kind of give them a different stimulation and get them to do something different. So there's a lot more to it than that, but that's kind of it in a nutshell and kind of how we break down the categories of pain and treat them a little bit differently. And if you're in PT and you're not seeing that, you could certainly ask your therapist, or it just might be that person's not the right fit for treating the nervous system component.
Because the goal of the physical therapy, in essence, should be helping you get stronger, whatever, you're trying to solve so that you can not be there forever.
Right. Right, exactly. Unless you have some kind of like, I don't know, rheumatoid arthritis or something that's going to like chronically be inflaming your joints. The ultimate goal should be that like we are a bridge to get you to being able to do what you want to do and like get into like a community-based or gym-based fitness program like what you guys do, because that's going to be more practical for someone than, I mean, sure, I could train them, but that's not really my job. Like you're the trainer. I'm supposed to get them to the point where they can see you, right?
Pass back and forth.
Yes, exactly.
So, with when we're talking about physical therapy, how much of what you see and do is you kind of see of people their lack of strength? You know, women coming in, you know, and their lack of strength is what's communicating pain. Is that, am I saying that
Yeah.
correctly?
Yeah, that's a great question. So, generally, weakness itself, like a weak muscle, that is not a reason that it will necessarily be painful. What we usually see is like if there's a weakness, the other muscles that can compensate for the weakness are what become painful. Like, for example, and I'm sure you see this a lot of women, whether or not they've had children, but especially if they've had children, will have a lot of weakness in their core and pelvic floor. Their abdomen, where their core is, isn't usually where their pain is. It's usually in their back or their, even sometimes like their shoulders or their knee or their hip, like it's somewhere else
Mhm.
that's away from the where the weakness is, because those areas are having to compensate for the core weakness, and then the tendons and muscles get stressed and can either be injured or like an overuse type injury or just like tight and irritated. So definitely weakness does ultimately cause pain, but maybe not in the way that we sometimes think about it.
Yeah. I think it's funny that we sometimes forget that like our whole body's connected.
Yes,
Like, why is my if my knees my knee hurts? Like, well, maybe your hips are tight, or does your back bother you? Like, why would
yeah,
that hurt? Like, well, because we sang a song when we were children.
exactly, yes.
So if I'm in pain and something's bothering me, and maybe just using the lower back, you know, as an example again, should I stop living my life? Like, should I stop doing the gardening? Should I stop working out? Like, what is the guidance for that? Because I feel like we sometimes hear or feel like, okay, I'm scared, so I'm not going to do that. Or our doctor might be like, no, you shouldn't be doing anything. And I feel like you need to be moving. Laying on the couch, you know, in some circumstances, 100%, you need to rest and all that good stuff. But movement is just so important, you know, for our bodies every single day. So how do you walk us through that a little bit?
Yeah.
And I
So
know
I
it's a
agree.
question.
Yeah, but I totally agree with you. There are very rare few instances where I think people should totally rest after an injury. That's usually like a fracture, like if movement is going to literally shift your bones so that it doesn't heal right, like yeah, you maybe shouldn't move. Other than that, there are very few instances where some sort of movement wouldn't be helpful. And a big part of why it's helpful, you know, it's kind of two components. I kind of mentioned that like high rep, low load type exercise that helps tissues heal. So if you're totally stationary, you're not putting any input into your tissues to heal, versus if you're doing even just like a little bit of walking around, some really gentle movement or stretching, your muscles are moving a little bit, and that helps move inflammation and bring more blood flow to an area that brings all the important parts of our immune system to help heal the tissues. So from like a healing perspective, movement is helpful. It's also really helpful to prevent that injury from transitioning into that chronic, more nervous system related pain. Because if we are immobile, because we're telling our body that movement is going to make it worse, our nervous system is going to be like, yup, movement is going to make this worse. And so every time you move, I'm going to send you a pain signal so that you stop moving. So we can kind of inadvertently teach our body to turn into chronic pain by not moving. And I definitely see that a lot. And it's unfortunate, because I think if people knew that they're not moving because they're being lazy, or they're trying to help themselves, right? They're trying to make a choice to help themselves, but it's just not what ends up happening. So I will often encourage, like, even if you can only walk for 3 minutes before your pain increases, that is way better than doing nothing. Even if the only thing you feel like you can do right now is like some diaphragmatic breathing and some gentle yoga moves or whatever it is, like, it doesn't really matter. Yes, there are things that you can do that are more helpful than others to heal your body based on what tissue's damaged, but the most important thing is that you are doing.
Right. Yeah. No, I agree, and I think that's a huge one. And this was so educational today. So I hope everybody listening, because we just don't get that information in regards to how our nervous system is responding. And I think that was just like mind breaking.
Yes,
That
definitely.
maybe I need to check myself. Like, what is this?
Yeah. And for me, like I actually experienced that personally to the understanding of this kind of nervous system component. So in my former life, before I was a PT, I was a ballet dancer and all through high school, and I studied dance in college, and I would always get pain in the front of my ankles when I landed a jump, to the point where I ended up having surgery, a couple of surgeries in my college years, and the pain never changed. It never went away. And I kept going back to the orthopedics, and, well, we could do a third surgery. Like, we're not seeing anything on imaging, but there must, obviously you're having pain. There must be a problem. And it flash forward to a decade later when I was in PT school and I was learning these principles, and I was really stubborn and really hesitant to admit that the pain that I was having was probably my nervous system, because I was like, but 10 years ago, the surgery helped for a short period, or the cortisone injections helped for a short period. So I must have tissue damage. Like, I'm different because I'm not like crazy. Like, my brain couldn't create pain. And once I finally kind of accepted that, this really is more like there's a reason, a helpful reason why my body continued to give me pain when I land these jumps, because it's trying to keep me from injuring myself again, because I'd gotten injured like that previously, and there's nothing wrong with me. That's a healthy thing for my nervous system to have done, but now I need to undo it. Since I started that practice, I have not had that pain again. And I was like, I'm going to end up having an ankle replacement. Like, this is going to
Yeah.
be debilitating. And it has not been that way, but it took me a lot to be able to get there, because it can be really unmooring to be like, well, what do you mean there's nothing wrong with my tissues? And people will hear that it's all in their head or that they're crazy. And that's absolutely how I heard it. Even though I was reading it in a textbook, nobody was saying that to me. But that's very much how it feels emotionally. But that is very much not what it is. I mean, yes, our brain is involved because everything we feel in our body is felt in our brain. But it is not that you're crazy. It is not that you're choosing this. It's that your body is adapting in a way that everybody's body adapts, and we just need to undo that adaptation.
So if I am somebody that has, a chronic back pain, sorry, it's just easier to keep kind of pouncing back on the
Yes.
same thing. And I'm like, ooh, is there things that I should do to kind of like stop and go, okay, Jillian, is this really pain? Should I take some deep breaths, like kind of collect my feelings? I said to everybody, like, how should I be? Is there better ways that we can approach it to kind of delineate, like, is this pain, or, is this my brain telling me there's pain? Like, you know what I'm trying to.
Yeah. I think honestly, sometimes we need guidance on that. Like, if that is something that you're finding happening a lot in your life, like, you probably need a physical therapist who has expertise in working with chronic pain to find really specific techniques that work for you. But from a general perspective, I think stopping, taking a deep breath, telling yourself, okay, like, I might have just injured my back, but I might not have. Not immediately stopping the activity, but trying to do it again, maybe slowly, maybe not as robustly, but kind of stopping the cycle at the very start of saying, like, nope, this is not going to be something that changes the way that I move. This is not going to be something that, prevents me from doing what I need to do. Now, if you try to do it again a few times and it still hurts, like, maybe you really did injure something, or, maybe like right now your nervous system is just too upregulated for whatever reason, like maybe you've had increased stress or you didn't sleep well last night or whatever, but it's just not going to change for you right now. You're just like, okay, I'm going to move on from that, but I'm not going to let it stress me out, and I'll try it again another time.
Right.
And if it still hurts, then I might seek out some help. But I think the idea of just not letting yourself stop that forever, or even for even a few days, but saying, like, right now is not the time, but I can try this again. can help that cycle from starting to ramp up.
Sure. Now, what about the complete opposite side of it, of somebody that's like, I can't do this. I haven't been, this hurts. I have been ignoring it for 3 months. It keeps getting worse. And I'm like, why have we not gone to the doctor? Because if it's been that long, you know, what's the point of, at some point, what's the point, I guess, as far as, recognizing that something hurts, but not ignoring it so long that now you're creating greater injury to yourself?
Yeah, that is a hard balance to find. I would say that generally, unless it's a really severe injury, most acute injuries will heal between 4 to 6 weeks. So if you're getting to that 1 to 1.5 month mark and it is not getting better, then you probably need some support. Or even if you're just getting into a week or two and it's getting worse instead of better, then you probably need some support. And again, that doesn't necessarily mean that you have a super severe injury. It just means that you're either the healing process or the nervous system adaptations are happening in a way that's a little bit atypical, and you just need some help to get that going in the right direction.
Right.
Yeah. There, I had a
All right. So at one point, for those of us that try to tough it out and ignore pain, I've had this shoulder that's been bothering me. Been like this for months. What's that fine line for us?
yeah. So I would say we don't want to totally ignore it. We don't want to make it the focus of our lives. We don't want to ignore it. We want to kind of have it somewhere in the middle where if we're having pain, we're respecting that. We're saying, okay, my body's trying to tell me something. Either there's an injury or my nervous system is, a little bit dysregulated right now. And whichever of those ones it is, I should kind of honor that and take care of that. So even if it hasn't been that 4 to 6 week period where you would expect something to be totally healed, you can still do things to try to bring your pain level down, like heat, ice, gentle movement, massage, so that you can prevent it from coming up into that chronic level. What can happen over time if you're totally ignoring it is that if there is some, particularly in the shoulder, like maybe you had a minor strain in your rotator cuff that could have healed, but you didn't do anything about it, and it's worsened over time, and now you need a surgery. Like, you don't want to get it to that point either.
Or
It is a fine,
pain, I guess, is too like, oh, it hurts, but it's fine. I'm just gonna keep going.
yeah. And my personal opinion on that is, like, if it's a mild pain and it doesn't continue to hurt after, like, sure, that's probably fine. If the person is like wincing and they're sore for 2 days after they work out, like, is that really how they want to live their life? So I think people have this idea too, like, well, I don't want to go to the doctor because they're going to tell me I have to do surgery, or they're just going to give me steroids, or, for example, and I don't believe in that. That's fine. Like, people should make their own healthcare choices, but you should probably still maybe seek out some help and see what the answers are before you decide that it's not going to be helpful.
Right. Yeah. And it's too just making sure that it's not a bigger issue that we're just
Right.
ignoring.
Right. Because I think something that we've learned today is, like, the pain does not correlate to the level of injury always.
Mhm.
So even if it's persisting for a long time at kind of not a super high level, it doesn't necessarily mean that everything's fine. So it's still worth having it checked and making sure it's not something that's going to get worse down the road.
Yeah. So much good information today. I'm so glad that we got on the podcast to talk about pain. Who
Me
knew?
too. Yeah, I love talking about pain. I think it's so interesting, and I think if everybody could just understand it even a little bit, there'd be a lot less fear and a lot more movement happening.
Yeah. I agree. I agree. So hopefully everybody got a couple tips here that they could walk away with, and start making some better decisions on how, I think it always just comes down to listening to our body, which I think sometimes is really hard for us to do.
Yes, definitely. Way harder than it should be.
Yeah, I agree. So Christina, we can find you in Chatham at Uplift Physical Therapy. So if anybody needs help or has additional questions, they can find you on Facebook and on your website.
Yes, I'd be happy to chat with anyone who is struggling with pain or has any questions.
Well, thank you again for your time.
Yeah, thank you so much.